I'm Leah. I'm going to be playing the midwife today.
I'm Delicia. I'll be playing the nurse.
I'm Rachel. I'm playing the patient.
And I'm Harjot. I'll be playing the family member.
And I'm Matt, and I'm the director.
Good morning, Delicia. So before we go into our patient's room, I'm just going to brief you about her. Rachel is a 21-year-old female and a first-time mother. She's unmarried and currently a student. She and her sister Jasmine are from a Hispanic background, live in a traditional household, and value family involvement and natural childbirth. She has no past medical history and is not currently taking or allergic to any medications. She has a family history of hypertension from her father's side and a history of diabetes from her mother's side. We will continue to monitor for preeclampsia. And they've also expressed a preference for clear explanations in simple terms and reassurance throughout the whole process since it is her first pregnancy.
Now that we debriefed, we should wash our hands. Today's going to be a great day.
I hope so too.
It's always a great day for hand hygiene.
Yeah, it's so important.
I love to wash my hands.
It's important that we keep ourselves and our patients safe.
Soap and water.
For 20 seconds.
Hello.
Hello.
I'm going to go ahead and close the door for some privacy. I'm Delicia. I'm going to be the registered nurse today.
And I'm Leah. I'm going to be your midwife for today.
Nice to meet you guys. So we're here to talk with you and your family members about your medication today. This medication is Pitocin. We'll go over what it is, how it works, and what to watch for. So please, at any time, stop me, and if anything isn't clear, you let me know. I want you both to feel comfortable and informed.
Before we start, can you please confirm your full name and date of birth?
Sure. Rachel Rafael 12/18/2003.
All right, thank you so much. Do you have any allergies to medications that you're taking?
Just prenatal vitamins and iron. No allergies.
Perfect, thank you. And this must be your support person?
Yes, my name is Jasmine, her sister.
Nice to meet you, Jasmine. We want you to be part of this process and know that we understand that your family values being together and supporting each other during birth. So again, ask any questions, share any concerns. You are a part of the care team today.
Thank you. In our culture, families always close during such big moments like these. And it means a lot that I can be here today and understand what's happening. Also, in our culture, we have this Mendoza shawl here. This is used during such important, vital moments for emotional support that I want to keep it with Rachel. Is that okay that it's with her to provide strength?
Of course. That's really wonderful having the support of you for emotional strength, safety, and including your culture.
Could you please explain what Pitocin is and how it will help me?
Yeah, of course. Pitocin is a medication that we use to start or strengthen your contractions. So it'll help tighten your uterus and get it into a steady pattern, which helps your body move into labor.
So it's kind of like what her body does naturally.
Exactly. Pitocin is a man-made form of oxytocin, which is a hormone that your body already makes to start the labor process. We're just giving you a small, controlled amount through your IV to help things move along safely.
That makes sense. I just wanted to be sure it was normal to you to need it.
It's completely normal. Many people just need a little help getting their contractions started or keeping them strong enough. We'll start very slowly and increase the dose only if your body needs it.
Perfect. That's good to know. Thank you for letting us know.
You're welcome. We'll be right here the whole time watching your contractions and your baby's heartbeat to keep you both safe.
Is this medication safe for my baby and me?
Yes, it is very safe. Pitocin helps your uterus contract so your labor can progress. We give it in small amounts through your IV, and we can adjust it lower or higher as needed.
Does it affect the baby at all?
We monitor the baby's heartbeat the entire time to make sure everything looks good. The Pitocin mainly works on the uterus. It won't go directly to the baby. So if you see any changes, we can stop or lower the dose right away.
That makes me feel better.
You're both doing great. We'll be with you the entire time, watching both you and your baby to keep you both safe and comfortable.
Is there anything I should watch out for or tell you while I'm getting this medication?
That's a good question. We're giving Pitocin through your IV right now, and we'll keep it running for a few hours. And while it runs, we'll check your uterus for any bleeding and your vital signs regularly.
Is there anything we should tell you right away?
Yes, please let us know if you're feeling dizzy, if you're having any chest pain, if your heart's racing, or if you notice any heavy bleeding.
Okay, I'll let you know if anything feels off. Perfect. Most people don't have any problems at all. We'll keep an eye on everything to make sure that you both stay comfortable and safe.
Thank you for explaining everything. This definitely helps us be comfortable and safe.
You're welcome. We're here for the both of you. Your recovery and your baby's safety are our top priority.
Is it safe for the baby if she's breastfeeding?
Yes, absolutely. Pitocin is safe during breastfeeding. In fact, it can even help your milk come in because your body releases natural oxytocin every time you nurse your baby. So, Pitocin and breastfeeding actually work well together to help your uterus heal and support milk flow.
That's good to hear. I was a little worried it might affect the baby.
It's a common question, but it's completely safe, and your baby benefits when your body produces that natural oxytocin too.
That's great to know.
Will I feel any pain from it?
You might feel some mild cramping, kind of like period cramps, but that's a good sign. It means that your uterus is tightening as it should.
But if the cramps become very strong or they don't go away, please let me know right away. We can adjust your IV or help with comfort measures.
Okay, I'll let you know.
Thank you for taking the time to explain everything. It really helps us understand what's happening.
You're both doing great. These questions are important. Asking them helps keep everybody safe and comfortable.
So most patients do very well with Pitocin, but we also want you to be informed of possible side effects, such as 5 reactions. One of them is excessive contractions. And since the Pitocin is administered via an IV to induce the labor, you should feel the contractions begin. However, if you do feel excessive contractions, you will adjust the rate or stop it accordingly. Another side effect is abnormal heartbeat from the baby, and this can be due to the Pitocin. So what we'll do is monitor the fetal heartbeat during the administration of the medicine, and we'll stop the Pitocin if there is a change in the heartbeat and turn you onto your left side. There's also a possibility of low blood pressure, so if you feel dizzy or lightheaded, we'll have you lie down with slow position changes, and we're going to monitor your blood pressure frequently. It's rare, but it is possible of allergic reaction, so we're going to monitor for itching, rash, and let us know if you even feel shortness of breath. And we can stop the medication and treat with antihistamines or even steroids if it's necessary. And again, this is rare as well, but uterine rupture is possible, and this would be like constant or severe pain or even unusual bleeding. This one is an emergency, so we'll stop the Pitocin right away and we'll call in the physician.
Wow, that's a lot to take in, but it's comforting to know that you'll be watching Rachel closely.
Absolutely. We're here to keep both of you safe every minute. You'll never be alone during this process. Rachel, you mentioned that English is your primary language and Spanish your secondary. We have printed materials and videos available in Spanish. We also have our translator who could stop by if you'd like. In the meantime, here are some great resources locally and internationally that talk about Pitocin, its effects, its adverse reactions, and anything else that you might be wondering about Pitocin.
Our first local source provided to the patient is Mount Sinai, which includes information for inducing labor, such as rupturing the membranes, using prostaglandins, and our medication today, which is Pitocin. It includes what it is, which is an IV medication to start contractions or make them stronger. It also includes what we're going to monitor, which is the baby's heart rate and the strength of the contraction. The information also includes why we're using the Pitocin, such as if the patient has high blood pressure or diabetes during pregnancy. Our second local source is New York Presbyterian, which includes alternative ways to induce labor, an alternative medication to induce labor, such as our medication, Pitocin, which can be given through an IV to soften the cervix, which causes the uterus to contract, inducing the birthing process.
Our patients can visit 2 trusted national resources. The Helion Journal article at Cell.com, which reviews Pitocin's safety and clinical use, and the National Library of Medicine at pmc.ncbi.nlm.nih.gov, which provides detailed research on its pharmacology and effects during labor.
So, in order to keep yourself safe, be sure to rest and stay hydrated. Let us know if you're experiencing any kind of heightened anxiety or if you feel that something is wrong. Be sure to keep up with your postpartum follow-up appointments and ask if you weren't sure about anything.
Thank you for explaining everything so clearly. I'll also be by Rachel's side and let you know if there's anything out of the ordinary.
Yes, it makes me feel much better to understand what's happening.
That's what we're here for. So we'll be back soon. And once again, congratulations.